a big bulk of my consult will be talk to them about their body contour and about tone of the muscle.
Hey guys, it's Paul Arvella from ProPhysique.com, and today I have a special guest, Dr. Jason Martin, MD, and what we're going to go over is loose skin. I get a lot of questions, and you know, as a client of mine, you know my methods, and I have the privilege of working with some amazing athletes. But you know, as ProPhysique has expanded, and we're now working with people in all walks of life, we deal with this issue of excess skin when a lot of weight loss happens, and I'm kind of at a loss on what to tell people outside of losing body fat, getting leaner. Hopefully they're on the younger side and there's a little more elasticity there, but even that I'm not familiar with. So why don't we just start with you and maybe give us your background, how you got into this, your credentials, and then talk a little bit about how to deal with skin as an issue.
Yeah, so my name's Jason Martin. I'm a board certified plastic surgeon. I have offices in Denver, Colorado, and up in the mountains too, currently in Vail. And I've been, working for a long time. We primarily what we treat is loose skin. It's loose skin in older people, loose skin in younger people with weight loss, and it's a real problem. And unfortunately, Paul, there's nothing you can do at the gym that could probably make it a lot better, right? And that's, I think in your position with Team Pro Physique and what you have to deal with your competitors, but also your lifestyle clients, which are the standard clients that I get in my office, it can be a real problem. And I think people, rightfully so, feel frustrated with having loose skin. And what are the causes of loose skin? I mean, there's many different causes: weight loss, pregnancy, and of course, aging. And those things are unavoidable in life for most people. Definitely for your female clients, so they can have all of those, and they can. And the problem with some of those things is the loose skin and the way that your skin changes, especially with age.
Yeah, so a term that I've heard before is like a mommy makeover, where I guess someone who's had a couple kids will go in after they're done having kids and kind of have some skin touched up. So can you go over, let's start with the most extreme case, someone who's lost several hundred pounds, because I've seen these on these transformations where they literally have to have a surgery to remove, pounds of flesh. Right. So in those cases, what's the procedure like?
Yeah, so you can go through the whole spectrum, and it's probably better, you're right, to start from the most severe, okay? Massive weight loss patients, and in my office, I usually, designate that as someone who's lost over 60 or 70 pounds. With the advent of bariatric surgery, which really became in vogue in the early 2000s, and it's really common now, so weight loss surgery, you're getting tons and tons of patients or people coming in with massive weight loss, over 100 pounds, and severe loose skin. In those cases, surgery is unavoidable. And the surgeries are pretty involved. Those surgeries involve body lifts, circumferential tummy tucks, massive surgeries on their arms and legs. And it's very involved. It's very expensive with a lot of recovery. But they are amazingly transformative. You can take someone with excess skin in all those areas, and you can transform their life, both the way they look and the way they feel, and their functionality. They can exercise better, and they can do all the things they need to do. Once your skin and soft tissue is stretched out, okay, from massive weight gain and weight loss, from a large pregnancy or whatever the case is, your skin will not go back. You noted at the beginning here, a younger person, they have a tendency to kind of snap back, and it's pretty amazing. I've seen young people who gained weight early on in their life and lost it in their 20s, over 60, 70, 80 pounds, and they almost have normal skin. It's pretty remarkable. But the average person that you talk with that, gains weight and loses it for, a large amount of weight, that skin will not snap back, and surgery is definitive. Those surgeries, as I said, are very involved. Those surgeries are expensive, and you will have a long recovery. You're talking about 4 to 8 weeks. You also have to go to a board certified plastic.
About maybe the cost, about insurance. So what is typical? I don't know if there is a typical, but let's say an extreme case where you actually have to remove skin, do some type of contouring, stitching, putting things back together. What would that run? And then what would insurance cover, if anything?
Yeah, so insurance sometimes will cover, especially the abdominal part or the belly part. You get the loose skin that hangs over in your belly. It can cause irritation. It can cause yeast infections. And insurances sometimes will cover that. It's called a paniculectomy. Whoever's listening to this, and you have this problem, you should look that up, because a lot of insurance companies will cover that. But they won't cover a lot of the things on the legs and the arms and the back. So those things can definitely cost over $10,000 if you're talking about multiple procedures, and that's out-of-pocket expenses. And then you have the recovery. If you have any kind of physical job, you won't be able to work at least for 3 to 4 weeks.
Oh, wow.
It's a major life investment, and it's a big recovery. But again, it's worth the transformation. It's amazingly transformative. The most transformative surgeries I do in my practice, which is very busy and it's all cosmetic, are post-weight loss transformations.
Yeah. So something you and I talked about, a long time ago, was potentially helping people that are in this situation by doing some research. So can we talk a little bit about, one of the more popular ways of losing body fat is actually like having it vacuumed out, taken out of your body.
Yeah.
And you and I both noted,
Paul, we like to call that liposuction, but you call it vacuuming. I mean, I did a lot of training to learn liposuction. But
I'm not going to use any big words, all right? You use big words. I'll let you sound smart.
Okay.
So what you and I both discussed was that people that get liposuction, that doesn't often last, because we're not changing the lifestyle and the approach of the person. We're kind of taking a shortcut, pulling some body fat out, but they didn't actually earn that fat loss. If you want to, they had to spend some money and some time, but what is the success rate for something like liposuction surgery? And does that also include a skin kind of tightening procedure along with it?
All right, so you're asking some really good questions. So we started with the major surgeries like a body lift or a circumferential tummy tuck. And then you can get into the things like mommy makeovers, which you talked about, which are tummy tucks and some sort of breast surgery. And mommy makeovers are necessary because the skin is so stretched out that it won't go back to normal, no matter what you do with nutrition and diet. Then you get into the middle part. People that maybe don't have super loose skin can get away with liposuction or maybe some other treatments we can talk about. Historically, we've done liposuction. I do a lot of liposuction in my practice. But, you and I have the same philosophy. I don't do liposuction on people that need to do like notable weight loss.
Okay.
I tell them no. And I say, you have to go get someone like Paul Revelle, Paul's too busy right now, someone like you, and you need to go get a coach, or you need to figure out what you need to do to get your weight in check, at least in a better place. But most people are pretty good, at least in Colorado. It's a very fit state. Yeah, exactly. And then, actually those people, by and large, tend to do pretty well. If you take a person who's empowered, educated, they tend to do pretty well with the liposuction. But if you actually look at the percentages overall in the field of plastic surgery, and that takes into account other states and different, beliefs and cultural backgrounds, it's not that great. There tends to be a notable weight loss after surgery. The conversation you and I have is about, are you born with a finite number of fat cells and you remove them with liposuction? Will you gain more fat cells back? The jury's still out on that, but in reality, liposuction is not a weight loss method, right? So liposuction is a contouring method for areas of fat that won't go away with diet and exercise. And a perfect example of that is a post-pregnancy woman, like many people that watch your YouTube channel, and they struggle with fat on their hips above their pant line. And they're in good shape, and that won't go away. Liposuction is a perfect answer for that. Those are hormonally driven deposits of fat that won't go away with, even with diet and exercise. Or you would have to cut so much. You would have to have a body fat percentage that's so low and not maintainable to get rid of it.
Sure.
Liposuction works really well for that. Now, what has changed in liposuction, this is important. So you're talking about, tightening the skin, is now in the past 10 to 15 years, and this is definitely one of my expertise, is we're doing liposuction with other devices. So we're doing the liposuction, as you said, quote unquote, Paul's words, vacuuming out the fat. And then we're using a device at the same time to tighten the skin. And this is how the field of plastic surgery or aesthetics has changed. This is the middle option that never existed before. I do these cases every day. I just did it now on a man who's in great shape. This guy works out all the time, but had fat on his love handles. And that's a real problem for men too, right? And he works out all the time, follows his nutrition, and I did one of these devices with liposuction. The device I use today is called BodyTite, BodyTite. I highly encourage people to look that up.
Okay.
It's amazing. You can look at my website, jasonmartinmd.com. There's tons of information there. With that said, BodyTite uses radio frequency energy underneath the skin to tighten the skin and destroy the fat, and then you suck the fat out. So that does solve the problem, taking the fat out and tightening the skin at the same time. But it does not get around the basic part of your question. If you do not take on changes in your life, both nutrition and exercise, and try to improve your life and use cosmetic surgery as something that empowers you to be more healthy, then the likelihood is you will fail. And I tell that to my patients all the time. We've had great results in our office, but I think it's important to bring up.
So let's talk a little bit about age and how that plays a role, because I think, as you said, some of your younger patients have seen some pretty amazing things. And, we've all seen the transformations online. I don't know how much of that is photoshopped and stuff, but, girls that have lost 80 pounds and it looks like they were always, since they were 16, skinny. They don't have any kind of negative body, issues. And maybe they had some surgeries along the way. But when do you typically see that the skin starts to become less responsive to weight loss for men and women if it's a different age?
Yeah. So this is so interesting because people's genetics are so different, Paul. And you see that with your training, right? Like you see certain people, when they cut down, their skin can keep their integrity, and other people, their skin just like falls apart. And, you don't know why that is. And a lot of it has to do with their cultural background, their genetic background. It could be related to their nutrition or what they're putting in their body, right? Are they supplementing okay? But it's a crapshoot. Some people really bounce back, some people don't. But no matter what, with age and pregnancy, your skin will change. Okay, so it gets thinner with age. That means the deep dermal layer, the meaty part of your skin thins out, and then you lose elastin. And elastin is what it sounds like. It makes your skin elastic. It makes it pop back. Kids have super elastic skin. And as you age, every decade in life, that elastin becomes less and less. And then you get into your 50s, 60s, and 70s, you can see the cumulative effect of that loss of elastin. And there's not a lot of answers for that, but there are these treatments. One of them, like I just talked about, BodyTite. There are external treatments. Microneedling with radio frequency is one of the good things that really treat the deep layer of the skin. All of our treatments for skin tightening treat the deep layer of the skin. So it has to penetrate down into that deep layer of skin and stimulate collagen production. Collagen is what makes the skin thick, and it gives it its integrity and rebuilds it, makes it thicker and more durable.
Oh, wow.
And so that's what we do.
At any age, that can improve.
Right, but every decade of life, the likelihood of that working goes down and down.
Yeah. Well, we all know, women or men in their 50s or 60s that you would swear they're in their 20s. They just have whatever environmental good history. They've avoided the sun. They've really taken care of their skin. They've always worn sunblock, whatever it may be. So, yeah. All right. So this is probably the bulk of what I want to discuss.
Sure.
How can people go about getting this started? Because I think a lot of it comes down to insecurity and not knowing where to start. Like, let's say someone's taken the right steps. They've lost their 50 pounds. They're really happy with how that's going, but they're still scared to take their shirt off at the beach because they have the flap or something that they're uncomfortable about. What's the first step for that person as far as how to get to where they're happy?
Yeah, you're going to like this answer. I think maximize your nutrition first, because the skin is an organ and it's always turning over, just like muscle. If you think about muscle and anabolism, the skin is the same. You're always turning over skin cells. So you need to maximize your nutrition across the board. And that's either get with someone like you, or I work with Amy. She's a nutritional therapist or nutritional practitioner, really kind of maximizing the nutrition. That's the first and easy thing you can do. The second thing is hydration. No joke. You need the dehydrated skin. It just doesn't look good. It doesn't have good integrity.
And that's
Third thing
hydration from the inside, right?
yeah, exactly. And then the third thing is lifestyle changes. Stop smoking, anything like that. Drinking's terrible. I mean, I hate to be boring, but that's the truth. From there, then you need to entertain, this is what you're getting at, is treatments. So there's three types of treatments. There's minimally invasive, there's, kind of like moderately invasive, which I do in the office, and then there's surgery. Minimally invasive treatments, anything that's external, okay, it doesn't work underneath the skin, it works on the outside of the skin, is only going to make data-driven, this is real data points, is only going to make your skin about 10% tighter. 10%.
What's an example of a treatment like that? What is that the needling you mentioned?
Yeah, needling, micro needling. One thing we use in our office is called Morpheus. That's also manufactured by InMode, but there's a million different devices like that. There's sculpture, there's things that use ultrasound, there's things that use lasers, there's all different types of technologies. Right now, radio frequency is hot. That's what most people are using, but it doesn't matter what if you go into an aesthetics office or a dermatology office and they say they're going to transform your skin with this or that, just know if it works externally, you only get 10% skin tightening. That's it. No matter what.
Now, is this something where you as a doctor have to say, all right, I don't believe that this first type of treatment is going to benefit you much, so we're going to skip to option 2, or do you try to walk them up the ladder?
Yeah, so I like to have people, I like to be very honest with people and straightforward.
Good.
I'm also a plastic surgeon. I have the capabilities to do that because I can offer every different type of treatment. A lot of places they go into, those people don't offer plastic surgery. So there's a financial incentive to keep them in the office.
So like
right?
an esthetician type of office,
yeah,
they might be
and,
able to do.
And I love those places and I support them. And I think they do a great job because not everyone wants to do surgery. It's a big deal and it's expensive. But here's the problem. If you have loose skin and then you go into one of those places and you spend $2,000 on this treatment that only gives you 10% skin tightening, and then you go into the next level, you just spent $4,000 or $5,000, $6,000 when you could have spent like $8,000, $9,000, $10,000 with a board certified plastic surgeon or someone like that and solve the problem. So I personally think you should find someone you can trust. It doesn't have to be a plastic surgeon. Someone's going to be honest with you and say, okay, this minimally invasive treatment will work, and that will work for a lot of people. Like your clients, they want to get ready for competitions, and doing something external like Morpheus would work great. I personally think the middle options are the best for most people, which is what I do. Things that work underneath the skin, that tighten the skin and destroy fat at the same time. So I use Body Tight, but there's Smart Lipo is one of them. Vaser assisted liposuction. There's a million different types of products, but they all use the same approach, which is underneath the skin and tightening the skin. Those will, at the best case scenario, like Body Tight, which is the best one on the market right now, will tighten the skin about 30% at the best case scenario. So if you come in with loose skin, it's going to be at least 30% better, not including any fat that was taken out. So that would make it even look better from there.
Okay.
In comparison with surgery, which will make it 100% tighter, okay?
Now, but surgery, correct me if I'm wrong, you're actually taking out a section of the skin and then pulling it together to retighten it, correct?
Right. So these things we do in the office, these middle options that I keep talking about, are done with local anesthesia, with you awake. You walk in and walk out. You make small little teeny incisions in the skin. You put tumescent fluid or, kind of a numbing solution in there, and you do the treatment with you totally awake, okay? Okay. So when you go on to surgery, that's in a surgical facility. You get anesthesia either through an IV or through a breathing tube. It's like a hospital, and you go into the surgery, and that involves longer incisions where you actually take out skin, physically remove the skin.
Yeah.
So the point is the technology now that we have is amazing. In my practice, it's very technology forward. I have tons of devices in my office, and I use them all the time. But it's not like Elon Musk and Tesla right now, right? You can't just go in and do something and all of a sudden it's autonomously tightening your skin. No matter what anyone tells you, that the best case scenario, you get that kind of half of what surgery gives you. Half, okay? And so if you're a mom that has loose skin below her belly that hangs over about an inch or two, a mini tummy tuck will get rid of that skin completely with an incision or a scar from hip to hip, where Body Tight would make it about 50% better, okay? And that just puts that in perspective. You have three different things: minimally or non-invasive, more evasive or moderately invasive in the office, and these are things that work underneath the skin that involve procedures, and then going to the operating room with a surgeon and actually doing definitive surgery. But
And I'm sure you
again,
have pictures of before and afters on your website of all these.
yeah, we have tons, and anybody who's reputable in the town that's you're watching this, is look at the website, the plastic surgeon that you know of. They can show you tons of pictures.
Yeah.
And that's the thing. Some people don't want scars, Paul. I mean, there's a cost for everything. It's not just financial.
Yeah.
These surgeries involve scars. You go to someone like me, the scars will look great. You're going to be happy with them, but they just don't want scars. And I'm sure you have competitors like that, right? But there's no way around it.
Most of the women are concerned about that line below their belly. My wife's had 2 C-sections. So, I mean, we had 10-pound babies, so there was no option for her. She's a tiny woman. But that's something she's, going to be conscious of. But,
Right. So C-section scars, which are called Phantom steel scars, are like way more common now. Like, before the 2000s, nobody was having C-sections. And now everyone's like scheduling their birth. It's totally changed in medicine, and that's actually made a boom for plastic surgeons because they already have the scar there. So if you have a scar that's right above your pubic hair and it's this long, and you could have a scar that's this long and have a perfectly flat belly, I mean, really? Wouldn't you just do that? And you can make that, crappy C-section scar look better. To me, it's a no-brainer.
Yeah. Yeah. So I guess there's a lot more options now. So another thing that I hear about, and I don't want to go off on a tangent on these things, but there does seems to be some devices that promise like fat loss through the skin. I've heard of a product called Coolsculpting and some others.
Yeah.
What are your thoughts on those? And is that anything that you do?
Yeah, so Coolsculpting is the most well-known. And the reason we all know about it is about 3 or 4 years ago, the company was really smart. They bombarded the internet, right? And used influencers. They're one of the first aesthetic medical companies to use influencers and do it the right way, or the way that people do it now.
Yeah.
And they really made a mark on the industry. I actually have owned Coolsculpting devices historically. They work well. Again, if you compare it to liposuction that I do in the office with You Totally Awake, Coolsculpting is going to get you at the most a third of what liposuction does.
Okay.
So that's the problem. They go in and say, oh yeah, we'll get rid of this fat. They're going to get maybe at best case scenario, and this is from the data, 30% improvement in that area. And the problem with Coolsculpting, it tends to cost a lot of money, a couple $1,000, right? Mm-hmm. So you can pay a little bit more and get liposuction and get it all removed. Why not do that? Well, people like Coolsculpting for the main reason of how they market it is you walk in and you walk out. You just put the panels on you, you freeze the fat, and you walk away. And over time, the fat goes away. That's called cryolipolysis. It's actually really interesting how it works. It just freezes the fat, and once it thaws out, it just kind of dies.
So those fat cells actually are just leaving the body through like urine or something, or sweat?
Yeah, exactly. You metabolize it. You basically absorb it, and all the particulates in you kind of pee out. So Coolsculpting, they say it's painless. That's not true. A lot of people have discomfort with it, but it's tolerable. They say that it has no side effects. That's not true. There's something called hyperplasia, where people can get re-fat growth even worse than what they had it before. That's a known complication with Coolsculpting, albeit rather rare. Secondly, there's not a lot of technique to it, right? So as a plastic surgeon, you come into me, I'm the artist, right, Paul? Like with you, I'm sculpting people and say, oh, we're going to do this here and really shape this out and do all this kind of stuff. And patients are all into it. Coolsculpting, no matter what they tell you, you go in, they have a little book. Okay, we put the paddle here, 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 and it's kind of cookbook, right? So you get what you get and you don't throw a fit. But I think it works well, but it's not going to solve the problem. If you have a little pocket of fat and you really don't want to do like a liposuction procedure, I think Coolsculpting is a great option for you as long as it's price appropriate.
Yeah, I think that's another one that I hear is kind of in the esthetician type offices where they maybe have a doctor overseeing their practice, but not someone like you that's actually performing it. So that would be my only concern. So
yeah, and I want to say this. I mean this honestly. I'm proud about what I do in my training, but I support those offices.
Yeah.
They do amazing work for these clients. They make their skin better. They do awesome treatments, and stuff like that. And I am totally okay, and as you are too, with your client or my client going to do Coolsculpting. I just think you need to be educated and empowered before you go in there. If you're okay with about a third of the fat going away, then that's okay. And I support you in doing that. It's going to be definitely be less money than doing something more formal. And it's a great option in the market, but it's not a replacement for surgery. Again, technology is great, but it doesn't replace me. It will, in the future, 10, 20, 30 years from now, it will. These technologies will work almost as well as surgery, but we're not there yet.
Yeah, I mean, for me, from an exercise physiology standpoint, the thing I worry about is, fat cells are essentially, they act as an organ in our body. They produce hormones. They change our, the way our, hypothalamus is performing. So I'm still like skeptical anytime I hear somebody say like, just kill the fat cells, because, that can, even just losing fat cells through dieting has a profound impact on the way we think and act and stuff. So those things make me nervous. But again, it's all about a personal decision. The bulk of what I wanted to talk about was this loose skin. And I really feel like you've done such a good job, like explaining it so well. Yeah, I don't know. Is there anything you think that would be pertinent to add to somebody that might be interested?
So I think that what you need to do if you're someone who struggles with loose skin is you need to, number one, see someone reputable and have them help you. And it doesn't have to be a plastic surgeon. It could be the esthetician. Know that if your loose skin is a little bit, so to put it in perspective, you can pinch less than an inch and you can't pull it far from your body, then most likely you can do one of these lesser invasive procedures, something on the outside that, like these needling techniques with radio frequency, whatever thing that works on the outside that supposedly tightens the skin, you can do that. If you can pinch about an inch or more and really kind of pull the skin away, and you have a lot of fat there, then that's where you get into those middle options, like Body Tight, Smart Lipo, Vaser, these things that you do in the office with you awake under local anesthesia. They have amazing results. If you're someone that you can pinch more than an inch and things hang over, you can really pull it out. You really see it on the arms in older women.
Yeah.
You see it on the neck. You see it like on the neck as people age. Post-pregnancy, you see it like you were talking about with the C-sections. It has a tendency to hang over the C-section scar. Those get into kind of more of a surgery realm. And to really make those go away, you're talking about, doing some sort of cosmetic procedure. And so those are kind of the three stratifications. If you try to put yourself in one of those groups and figure it out and go from there, I think that's the best way to go about it.
Have you come across people actually being a little bit scared of weight loss because of this reason? Like, I don't want to lose all this weight because I'm going to be left with all this extra skin.
Yeah, I have. I really have. And in Colorado, I see the opposite. Colorado's so focused on weight and activity that these people lose too much weight and they don't look good, right? And so it's not like I'm sorry to keep going back to your competitors, but it's not like your competitors that really have trained and have this muscle layer underneath to give them body contour.
Right.
Most people don't have that. They haven't been working out with strength training. And so you lose too much weight and you really do look scaphoid and kind of depleted. And that skin just really has no structure to hang on, right? Nothing that's there. And,
well, so here's a good last question that we'll go into, and this is something that I come across, and it's a lot of people say, I want to lose all this weight. Once I'm done losing this weight, I want to do a bulk where I put on a bunch of muscle. I always tell them it's better to put on muscle while you're losing body fat, because you can do both simultaneously if you're new to training, if you're taking care of your nutrition, and it seems to have a better response. I think a little more muscle fullness really is going to help with that skin elasticity versus at least in my mind, versus someone that just kind of crash diets all the weight off, loses 100 pounds, but they've also lost a lot of lean body mass in the process.
Yeah.
So is this something you recommend to weight loss clients?
Yeah, I always, I know you, so
yeah,
I've listened to you, but I always, every single one of them, a big bulk of my consult will be talking to them about their body contour and about tone of the muscle and about building a structure that can support that. The way out of problematic skin in many cases is weightlifting and strength training. I know that sounds crazy, but if you if you create volume, and women never, you get this all the time. The women are like, I can't put on volume. Anyone can put on muscle.
Yeah.
You just have to do it the right way. People don't want to put in the time. That's the really answer to a lot of problems, is really defining that lower structure. So if you're someone out there and you're like, okay, I'm listening to this video, or I'm watching, these guys talk, but I want to lose weight, but how do I do it the right way? I think losing weight slowly is actually extremely important. I think keeping your nutritional, supplementation at its peak and maximum is really important. So food sourcing, all the stuff that Amy talks about with us on our podcast, is extremely important. And then simultaneously really getting good strength training where you can get some muscle building, some muscle toning, is really important. I actually encourage my patients to take liposuction and then use that as the stepping stone to go into the stuff that you do. So it's all part of that shape.
Yeah.
Because Paul, you've seen it. You've seen it personally and professionally. You can get someone down to 7% body fat and they still have the fat on their flanks, on the top of their hips. I mean, some people just hold on to it, but creating that structure underneath is really the key. And that is true. Doesn't matter what age you are. Now, genetically, certain people have loose skin. There's actually medical conditions that cause loose skin. One of them is called Ehlers-Danlos. I've had a few of those patients. They have skin that's so stretchable that you pull it out like this, it goes way off their skin. It has no integrity at all. It's pretty amazing. And they're very difficult patients to operate on because they don't heal well. But having that structure beneath is really important. And I'm going to say something else, what you're saying. Fat is an organ, okay? And this is another thing Amy always talks about. And they're finding all these hormonal signaling pathways that involve fat now, tons. Yeah. And they're looking at those because of stem cells, right? Because that's a big part of what we're doing now. Stem cells are going to change a lot in the future, and even for skin tightening. So you need to think twice about aggressive full body liposuction, exactly what you're talking about. I don't think it matters if you do one or two areas, but you're talking about full body, like top to bottom. Yeah. I think that's where you could get into a problem in the future. And we don't know the consequences of that. Obviously, there's nothing. I mean, I do some of those cases. There's nothing in our data, our journals that show that has a life consequence to it. But, maybe it does. And, we fully don't understand how fat works still. It's 2020. We don't have a full understanding of fat. And I think
it's a bad word, but I don't think it's a bad thing. And I think that's what we have to understand, that fat is good, and don't fear fat nutritionally. Don't fear fat on your bodies. Certainly not being obese and being healthy requires you to have less body fat, but there's such a thing as, not as being deficient in human body fat. And that's, as competitors, that's what we have to pay attention to, is that when we get below our set point, that there is going to be a consequence. And that's what we deal with as physique competitors. But we never, at least I as a coach, never tell people that this is a maintainable look. Like, you are going to be in trouble if you try to stay this lean. It's for a purpose, and then you bring back up to a good, healthy place. And that's what I focus on.
And take as many pictures as possible and put those on Instagram. That's what
those are the only ones you post. Well, I'm going to ask you for a favor. Sure. I want to see one of your most incredible before and after transformations, so I can use it for the thumbnail for this video, just to show people what's possible as far as fixing loose skin. But I certainly appreciate your time. I think that'll be it for today for the questions. So thank you, and I'll put all your information below.
Yeah. Hey, Paul, thanks for the opportunity, and thank you for all the stuff you do.